Hey everyone, welcome back to the channel. Today we're diving into one of the most essential skills in clinical medicine, how to take a clear and structured medical history. Start by introducing yourself to the patient, confirming their identity and explaining the purpose of the visit. Make sure the patient feels comfortable and that their privacy is respected. Next, ask about the chief complaint. That's the patient's main reason for coming in. Say something like, "What brings you in today?" or "How can I help you today?" Let the patient speak freely and describe their issue in their own words. Now let's move into the history of present illness. Using the LQQ Opera framework, this helps you explore the symptom in detail. Let's go through it. L stands for location. Ask, where exactly is the symptom? Can you point to it? Does it radiate anywhere? Q stands for quality. What does it feel like? Is it sharp, dull, burning, or cramping? The other Q stands for quantity or severity. On a scale of 1 to 10, how severe is it? O stands for onset. When did it start? Was it sudden or gradual? P stands for precipitating factors. Does anything trigger it? E and R stands for exacerbating and relieving factors. What makes the symptom better or worse? A stands for associated symptoms. Have you noticed any other symptoms happening at the same time? Next, ask about the patient's past medical background. Start with, do you have any long-term medical conditions like diabetes, high blood pressure, or heart disease? Have you ever had any surgeries? What kind and when? Are you currently taking any medications or supplements? Do you have any allergies to medications? What kind of reaction did you have? Have you ever been hospitalized before? Then ask about family history. Do any illnesses run in your family like cancer, heart disease, or diabetes? At what age were they diagnosed? And finally, social history, including their travel and exposure history, daily life and occupation, smoking, alcohol and recreational drug use, and sexual history if appropriate. Always adjust your questions based on the patient's age, gender, and clinical setting, and be respectful and non-judgmental at all times. Now let's move on to the OBGYN history, an essential part of the medical history for female patients. If haven't already done so, ask about the patient's sexual activity in a respectful way, such as, are you currently sexually active? Do you have one partner or multiple partners? Do you have sex with men, women, or both? Do you use any form of contraception or protection? Then ask about the patient's menstrual cycle with questions like, at what age did you have your first period? When was your last menstrual period? Are your periods regular? How many days does your period usually last? Do you experience heavy bleeding, severe cramps, or any other symptoms? Ask about the patient's gynecologic history with questions like, have you ever been diagnosed with any gynecologic conditions such as ovarian cysts, fibroids, or endometriosis? Have you had any sexually transmitted infections or pelvic inflammatory disease? Have you ever had surgery involving your reproductive organs? When was your last pap smear? Have you ever had a mammogram? Next, ask about the patient's pregnancy history, often referred as GPO. G stands for gravida or total numbers of pregnancies. T stands for term births. P stands for preterm births. A stands for abortions or miscarriages. And L stands for living children. If there's vaginal discharge, ask about color, quantity, odor, and consistency. Now for the final part of history taking, the review of systems. This can be comprehensive or focused depending on the situation. Here's a quick breakdown. Constitutional symptoms include fever, chills, night sweats, fatigue, unintentional weight loss, and changes in appetite. Hematologic symptoms include easy bruising, prolonged bleeding, swollen lymph nodes. Skin problems include rashes, itching, dryness, hair loss, and changes in nails or skin color. HEENT refers to head, eyes, ears, nose, and throat. Head symptoms include headache, dizziness, and trauma. Eye symptoms include vision changes, eye pain, diplopia, and redness. Ear symptoms include hearing loss, tinnitus, and ear pain. Nasal symptoms include congestion, nosebleeds, or sinus pressure. Mouth and throat problems include sore throat, hoarseness, dry mouth, oral ulcers, difficulty swallowing, and bad breath. Cardiovascular and respiratory symptoms include chest pain or tightness, palpitations, tachycardia, shortness of breath, peripheral edema, intermittent claudication, coughing, sputum production, and coughing up blood. Gastrointestinal symptoms include nausea and vomiting, abdominal pain, heartburn, constipation or diarrhea, and blood or tarry stool. Genital urinary symptoms include urinary frequency, urgency, burning sensation when urinating, blood in urine, incontinence, or unusual discharge. Endocrine symptoms include heat or cold intolerance, increased thirst, sweating or urination, and changes in energy levels or hair distribution. Musculoskeletal symptoms include joint pain, stiffness, muscle aches, limited range of motion, and back pain. Neurological symptoms include dizziness, numbness, tingling, weakness, seizures, tremors, and memory issues. Note that this is not an exhaustive list. It's a general overview of common symptoms you may encounter in each system. And that wraps up our full guide to history taking, from the very first question to the review of systems. Thanks for watching, and I'll see you in the next one.